105.1 The Buzz. I'm Sheryl. I'm with Dr. Michael Workman. Where did our summer go? It was so warm and beautiful yesterday, and
I
I'm
know.
like chilly today.
I know. It's coming back this weekend. It's supposed to be 80s and 90s next week, which is really cool.
Which means people are going to be wearing less clothing and noticing all those areas that they,
That they don't want to
that I've been
notice.
calling you about.
Well, yeah.
Cool sculpting still super popular
Yep.
for those areas. Maybe you've been dieting, you've been exercising, you've been working hard to get into swimsuit shape,
Yep.
but there's still like maybe that tummy pooch that won't budge, or the saddlebag area, or love handles.
Oh, chin.
Yes, I actually discovered a new area the other day. The little bulge of fat that bulges like
That
after you
bra
put your
strap?
bra on. Yeah, and you can
I
see it through
know.
a t-shirt.
Yeah, yeah.
Now that it's t-shirt weather, noticing that
Yeah.
a little bit more.
I mean,
Can Cool Sculpting treat that?
Oh, absolutely. We do a lot of bra strap fat. I think that's an ideal area for it. It was interesting. I saw a patient today that we had done chin on last week on one side. And I mean, she was just ecstatic because you could tell a difference a week later. And, normally it's, we tell people, 6 to 8 weeks, but it's just, it's really neat that way, and I think especially coming into summer, and that everybody's results are different, but it was just, you look at her and one side was just cool and the other side was kind of fat. So
Now, in what cases would you do one side and not the other at the same time?
oftentimes we'll do both of them. I think occasionally if someone doesn't have a lot of time, if they're in a hurry. We've got people flying in from the East Coast that they'll do 4 or 5 hours, and we get 2 machines going, and we can really cover a lot of ground. But I think that sometimes it's a time issue and
Yeah.
whatnot.
Now, I want to mention that one of the things that makes your office unique and definitely like first choice on your list for Cool Sculpting is you have dual machines, so you can actually treat both sides at the same time.
Yeah, and I think that's patients love it. You combine the fact that we can do 2 areas with 2 different machines, with the fact we've got the latest applicators, and you should always check because the latest applicators, they take half as long. They probably remove more fat. And pain thresholds or discomfort thresholds, we don't call it pain, are actually lower with the new machines because they get colder, and so it works better.
Now, what's been the most unusual area that someone's asked you to treat with Cool Sculpting? Because we all have those spots that bug us.
Yeah, I think knees. We see a lot of women carry a little more fat in between their knees, and so we've got a new applicator that will just go right in between, kind of where the knees knock together, and that can really have a slimming effect on your, in a dress or whatnot.
Yeah. Now, I have a question about the chin area because I've actually been thinking about having that done myself.
Okay.
So now, when the fat dissolves and is eliminated out of your body naturally, that's the way Cool Sculpting works. What does it leave extra skin? Do you eventually need to have that skin like surgically tightened up?
No, only in a very unusual case. The FDA has actually approved the Cool Sculpting for skin tightening. So we don't tout it as that, but especially in the chin area, I think oftentimes we'll get some tightening. And the other thing is it depends upon the elasticity that you have to begin with. And we normally wouldn't do Cool Sculpt or liposuction. Let's say you've got the hanging skin, and then you're not a candidate. It's for those of us that you're doing the selfie and it's like, oh my gosh, I had no idea how full my neck looks. So a lot of it is who we're treating.
So that's why it's so important to go in for the free consultation and have Dr. Workman's staff look and assess and give you their expert professional advice. And, a great opportunity to do that. The open house. I'm going to be there June 21st.
I know.
6 o'clock, the Clackamas location. And like I mentioned, I'm thinking of having some Cool Sculpting done. So if I go ahead with this, you can actually watch it happen, ask questions. There's going to be special pricing, light appetizers, refreshments. And I know you guys have done giveaways at these events in the past.
Yep, we have prizes and all that.
Oh, yeah. It's a really good time. If you want to go, RSVP at drmichaelworkman.com, drmichaelworkman.com. Go to the website. RSVP. Would love to see you out there.
Quick question.
Yes.
What area are we doing on you? Talk to me.
So
Talk to me,
you know
sister.
me too well because you know that I
Yeah,
usually have
I know you're
a
thinking
list.
about it.
I'm thinking perhaps tummy pooch because I've just
Okay.
been enjoying too much good food and wine lately.
Yeah.
But the chin, maybe.
Yeah.
You know, I've noticed the profile maybe isn't
Okay.
everything I'd like it to be. So I might end up tossing a coin. We'll see.
Okay. All right. Looking forward to
See you
it.
soon.